Hello and welcome to this episode of the Hospital Guide. In today's episode, we will be discussing something which is very important to all of us, and that is the damage which is caused by the earphone and how you can prevent the earphone. Now, did you know that 1.7% of people that who use the earphone or the headphone are predisposed to hearing loss? And I think that is a very, very significant number, because in a room full of about 100 people, two of them would be having some sort of hearing damage. Recently, there was a case in Uttar Pradesh, Gorakhpur, wherein a class 11 student suffered from hearing loss or deafness because of the use of earphone. He was a class 11 student and he was listening to music on his earphone for a prolonged period of time. He was also sharing his earphone with his friends. Gradually, he developed some sort of a ear infection and then there was ear discharge. He was taken to a hospital and the doctors then did a test, which is the audiometry, to assess the hearing function of the ear. And it was found that both his ears had damage. One of the ears could be medically managed, but the other ear he had to undergo surgery, and gradually then he recovered his hearing over a period of time. Now, what are the types of devices that can cause hearing loss? It's not necessarily that there's any particular device. You could probably be having a headphone, or you could be having the older earphones with the wires that we're using, or it could be just the earbuds that you use these days. All of these devices can predispose a person to hearing loss. What is the mechanism of hearing loss in these people? It has been found that when you're using a plug, when you're using this kind of earphone, what it does, it decreases the circulation of air in the ear. The ear has got three components. It's got a external ear, which is what you see. This is connected by a fine tubular canal to something which is called as the middle ear, and then the middle ear is connected to the inner ear. All these things are connected in a cyclical manner, and the sound travels from the external ear to the middle ear and then to the inner ear. So what happens is, when there is a earbud or a earphone or a headphone, the air is not going to be circulated. There is going to be infection in the ear canal. This infection is going to limit the flow of sound by one mechanism, or the other is, if the infection is for a prolonged period of time, it can also cause damage to the nerves of the ear canal and therefore cause a hearing loss in these patients. So therefore we can see that it is not that if you use a very high fundo device, you're not going to be having effects, or you're using primitive thing, it's going to be larger. It's not like that. All devices are equally predisposed to the damages of using a hearing device. Now, if at all you have to use a earphone, you may be in a profession like an IT or a BPO industry, or you may be in some sort of a profession where you have to use a headphone or a earphone. Then how do you protect yourself? There are certain strategies that you can deploy to minimize the effects of these earphones. One is, you have to decrease the volume that which you hear on. So the sound that the loud noises that you expose yourself, you have to limit the volume. Second is, use a noise cancellation headphone. There are a number of noise cancellation devices which are available. You guys know better because you're much adept with technology, but you can use a noise cancellation headphone. If at all you have to use a earphone or a headphone, it's better if you use a headphone, because the headphone sits on the outside as compared to a earbud or a earphone which goes right inside the ear canal. So it's better to have a headphone if at all you have to use it for a prolonged period of time. Also, you need to take listening breaks. Now, how much listening break you can take? If you're listening for a period of 30 minutes, you can take a 5-minute break. If you're listening for about 60 minutes, you can take a 10-minute break. There is also a 60-60 rule in medicine, which can limit the noise that you're exposed to, which means 60% of maximum volume for a period of maximum 60 minutes, and then you can take a break. The National Institute of Health also says that for a sound that you have to use, it should not be too close, it should not be too loud, and it should not be too long. So hope that today's episode has been immensely helpful to you. You will decrease the exposure of noise to your ear and you will protect your ear from hearing loss. Thank you so much for watching. If it has been useful to you, please like and subscribe the video and share with others for maximum awareness. Thank you so much.